Well, good morning, everyone. Welcome to Building Healthy, Strong Communities, Session 1, Supervision in Complex Organizations, Strategies for Building Healthy Teams Across Reporting Lines. Before we begin, I want to go over a few housekeeping notes. If you wish to receive CEs for today's webinar, you will need to stay for the duration of the event and respond to all of the poll questions that pop up throughout the presentation. You will see that first poll now. If you do not see the poll, please put your response in the chat. So this question is, who is in the audience today? Alumni, SSW faculty or staff, student, MSW or PhD, or other, and tell us in the chat. There will be time for Q&A at the end of today's presentation. If you have questions, please put them in the chat or the Q&A box. We encourage participation in the chat throughout today's presentation. I am now going to turn it over to Jan Fisher, a member of the SSW Alumni Board, to introduce this session's presenter.
Thank you, Madison. I'm so excited to introduce Erin Kong. She's the Director of Field Education and Clinical Assistant Professor at the University of Michigan School of Social Work. She received her MSA degree from the Mandel School of Applied Social Sciences at Case Western Reserve University. Prior to this, she began her career at Cleveland Clinic and then worked at Michigan Medicine for over 17 years as a pediatric nephrology clinical social worker, MSW field director, and healthcare clinical and administrative leader. Kong was the inaugural Michigan Medicine Social Work Department Diversity Chair and was co-creator and leader for the Innovative Healthcare Equity Consult Service. Areas of interest include healthcare equity and interpersonal education and research. Welcome, Erin.
Thank you so much. Madison, there's a hand raised, so I don't know if we want to address that, but let me share my screen. Okay, hopefully everybody can see the slides there. All right. Hi, everybody. Thank you so much, Jan, for that lovely introduction, and thank you to the School of Social Work for this opportunity to share some thoughts around supervision and leadership in this space. We will be using the chat a bit during this time and break up this talk with some polls, as you know. So if there's any questions, feel free to put those in the chat and we can answer those at the very end. And we'll have some time for that as well. Right. No disclosures to report today, no conflicts of interest or anything like that. So the objectives for today, I hope to discuss some organizational structures and supervisory models, really hoping to share both skills and strategies in this space. I think sometimes when I go to CEs, it's often lots of information, but I'm often left with what am I supposed to do? So I hope today I can share some of those things with y'all today. Hope to review the characteristics of psychologically safe teams and how that impacts team functioning. I see that as really critical in this space. And then discuss supervisory, like I said, support strategies and skills for those of you who are team leads or maybe who aspire to be team leads. Jan shared a lot about me on the professional side. We often are asked to share our bios. But I thought that it's really important, and I've started to do this on talks, is just to share things that are not necessarily what you put in your professional bio. And so, these are some of the identities that I hold and things that are really important to me. I know that there's privilege in being able to share some of these versus others in certain spaces, but I do think it really has impacted my ability to navigate certain spaces in both leadership and in the health system and in here in higher ed. And it really has actually helped in many ways to connect and build rapport, but also to navigate spaces where I often have been in spaces where I am acutely aware of who I am. And I mean that in every sense of the word around my intersectional identities. And I've tried to use that actually as an opportunity to engage folks in maybe environments that are not as inclusive. And so one thing I did want to share is a little bit of leadership context just for the purposes of why are you the one giving this information? And so just a little bit of leadership context for me, as stated, I worked in major health systems, and the last one being Michigan Medicine. And just for those who are unaware, it's about 25 to 30,000 employees total. And we had originally a certain supervision model and leadership structure when I had first gotten there about 20 years ago. And it really evolved into a more matrixed organizational structure. And so I can kind of speak to both of those. During COVID, I had approximately mid 70s, so 72 to 75 direct clinical reports to me. And that was both in the practice area and a few program managers as well. And so that just gives a little bit of additional context as I begin the talk today. So with that, we have another poll. It's technically poll two, because I think you had one poll already, but I would love to hear if Madison, you could open that up. Just how many years of HR leadership or supervisor experience do you have? Just to get a sense of who's in the room a little bit. So we'll give you a few seconds to answer that. I think if you're not able to answer the poll, I believe it counts. You can also put in the chat. Just want to make sure that for those who want CEs that you get the CEs. Thank you, Madison. So it looks like actually fairly split. So we have some early career leaders in this space, 0 to 4 is almost 41%. And then there is a subset of those of you 5 to 9 years, 15%. And many of you have experience of 10 plus years. And 14% of you on this call do not have any experience yet, but you certainly know, I'm sure, what it's like to also be on the other end of being a team member. And so really welcome your feedback or questions in this space as well. And like I said, some of you might be aspiring to also lean into leadership positions moving forward. Okay, a little bit just about organizational structure. So I mentioned this a little bit that Michigan Medicine had shifted a little bit, at least my personal experiences, but these are kind of the major organizational structures. There may be other ones, but I think these are the most common. And so if you look at kind of the ways in which organizations can structure their supervision or support, it can be by department. It certainly can be divisional by service or region. It can be by project. And then, of course, this matrix or dual reporting situation, which more and more large organizations I feel like are leaning into. And so I think I want to just go over briefly pros and cons of each, so that if you're in a position where I feel like as you progress in your career and your sphere of influence grows, you may want to take a look at what that supervision kind of model is or support structure is in your organization, and maybe make some suggestions. So starting first with the functional one by department, I think the pros of that really is that you get deep expertise. I think the maybe negative or con is that it sometimes creates silos and it can slow kind of cross-departmental work. And so this was really the model that I was initiated into in a healthcare setting. Is our identity as a social work department was very strong. And I thought that that was very empowering as a new social worker in that space, because as you know, it's a very complex system. And so to have that identity as a medical social worker, or a psychiatric social worker in a health system, or I am a transplant social worker, it really did create that vibe of deep expertise. But it really was because we were isolated in some ways. Not everyone exactly knew what social workers or social work department did or could contribute to. So I also experienced the opposite. When you structure things by division or by service or region, really the pros are the focus and accountability within divisions. So now you're looking at it is maybe interprofessional or interdisciplinary in that space. But the con is that you could be duplicating resources or time in that space. For if you're going to organize it by project, the pros of that are it's very clear focus. There's a clear focus and you have clear kind of authority structure in that space. But the negative of that is there's really no functional home for the people who are in that space. And so once a project is completed, as you can imagine, it's kind of done. And so there's kind of no identity in that space, and you have to move on to the next project, assuming there is a next one. And then the matrix one, which again, I will say to me is one of the more complicated ones. You have really a dual reporting situation. For example, I might be reporting both to a functional manager and to a project manager in that space. The pro of that is it's flexible. You can certainly share resources and expertise in that space. It does break down silos in some respects, but the con is, again, the complexity of that and the potential for conflicting priorities between those two managers and departments. And I have firsthand seen that as well. And so again, no right or wrong, but just what works for your organizational size and complexity, but also kind of the appetite of the senior leadership as well. I wanted to also go over to kind of the level set where we're going and offer some models of supervision, and then we'll get into the strategies and skills. So there's a few here. I'm going to give you three. The first one is restorative supervision. I don't have a graphic for this. I think most of us, if not all, might be social workers by training, but I don't want to assume. And so restorative supervision is what it is, but I just wanted to highlight a few things. So it really is developed as a solution to the emotional demands being placed upon many of us. It originated particularly in health professions, but it's not exclusive to at this point. It was initially piloted with hospital midwives, gynecology nurses, and doctors back in 2009. Some of the benefits include providing a supportive and challenging supervisory environment, or it provides a supportive, environment in a challenging space. It improves the capacity of the individual to remain resilient in the face of those things, in the face of challenging work. It enhances the ability of professionals to relationship build with other fellow professionals to avoid kind of feelings of isolation and to reduce difficult colleague behaviors in that space. It encourages the professional to focus on the events and or the situations that they can change so they can experience less helplessness in that space. And finally, it improves the ability of the professional to communicate issues so that they can escalate those effectively. And so results from this program have really, or this model, have really shown how individual sessions of restorative supervision followed up by group experiences really has shown a significant impact on reducing burnout and stress while maintaining job satisfaction. This 4x4 model, let me show a graphic really quick. So this 4x4 model is another model of supervision that's been used extensively in the child protection space and context. It's first developed by Toni Morrison. This model recognizes the interdependence of the functions of supervision, their impact on key stakeholders, and the four elements of the supervision cycle. So let me just briefly go over this. So there's four functions of supervision: management, development, mediation, and support. And then there's four stakeholders in the supervisory process. So you have the service users, I would say the clients or patients, the staff, the organization itself, and then the partners. And then there's four stages of the Kolb learning cycle: experience, reflection, analysis, plans, and action. And so the recommendations on how to use this model include balancing your sessions and to avoid overemphasis on administrative agenda items. I think I've been in a lot of one-to-ones, particularly early in my career, where the agenda was really a checkbox of things that I had to just go through administratively or maybe around productivity. And this really shifts the focus in that space. Another recommendation is to use reflective questions, of course, and to focus on the client rather than updating those task lists. It helps to ground the supervision in practice and not necessarily in the doing piece. It intentionally addresses the staff's well-being. And it allows you to connect the work to the strategy and any needed organizational resources or policy. So it's really an opportunity for your staff member to relay to you what their needs are in a supportive way, hopefully. The third model that I wanted to share is something called a 5x5 model. So the 5x5 model was developed by the Northern Ireland Social Care Council in 2015. It is also a model for reflective practice and supervision specifically in social work, so I thought it was relevant. This was developed with 5 domains and dimensions in mind. The 5 domains are not to be covered necessarily in a single session. That would be quite overwhelming. But supervisors are really encouraged to pick a few of the relevant domains in the space. The author developed these areas by identifying them and kind of naming that there really are a set of interlinked domains, and that power is central to all of them. And again, I hope that resonates with folks on this call. And so just briefly around the 5 domains. Psychobiography, they name as an examination of the life course. It really looks at significant life events that have shaped a person's life psychologically. It looks at issues such as loss or identity crisis, transitions, or opportunities for growth as pieces for you to take into consideration as you're working with someone. Relationships, it covers issues related to family or the recognition with other human relationships, it says. So anything around relationships and how that has impacted them previously, they will bring that into this space. So that's important to know. Culture speaks to covering social norms and issues related to any inequality as well. Organization, of course, addresses organizational issues, including management and bureaucracy, and looks at how possible improvements might be made. And then finally, politics and economy. As we know, we don't live in vacuums, and we don't live external to what's happening, particularly in this moment in time. And so we live in a very political and economic context, and it really tries to incorporate the wider systems of the society we live in. And I think I will share from personal experience that this has been incredibly important, necessary, and almost required of me, I feel like, in this space to humanize folks who I am in contact with here. Because again, there is so much going on. To act like nothing's happening it is also has for me not been an option. And so I think it's really important, again, just to signal that you're open to that, to not force folks to necessarily talk about those things, but to allow space for individuals to share what they are bringing into work, that we bring our whole selves to this space. Okay. Next, so now I'm going to start talking about strategies. So how I kind of organize this a little bit is there's a strategy and then there's some skills. And so this is certainly non-exhaustive, but just I was thinking of a way to kind of frame or package all this stuff. And I really welcome, as we go along here, if there's additional strategies or skills, I think to crowdsource this. If we were in a room, it would be a little bit more interactive and I'd have an ability to have you all share out. But at the end, if there is an opportunity for you to share in the chat, or maybe we can unmute at the end during Q&A, I really would welcome any other suggestions or skills. So for building healthy teams, strategy number one, I really thought about first, of course, starting with psychological safety. I think this is a key to a lot of issues and concerns in organizations. And so just talking about building and maintaining psychological safety in this space. If you're unfamiliar, Dr. Edmondson is a professor at Harvard and has done extensive TED Talks, videos, papers, books. So if you're really interested more in learning about this topic, please feel free to look up Dr. Edmondson. She defines psychological safety as is on the screen, a belief that one will not be punished or humiliated for speaking up with ideas, questions, concerns, or mistakes. And the team is safe for interpersonal risk taking. So we'll talk a little bit more about that today. So one thing I wanted to do just to pause, and this is where I would actually really welcome you to use the chat. So thanks everybody for sharing some of where you are. Is I wrote that intentionally. So how do you know if your team is psychologically unsafe? Not safe. I'm going to flip it. So are there traits or are there behaviors that would signal to you that your team is unsafe? If you have any examples, please certainly don't name anyone in particular, but situations, I think we've all been in situations and teams, and we can feel it, / we know it when we see it and we experience it. So yeah, there's secrets. Thanks everybody for putting this in. Silence is something what somebody put. Triangulation for sure. No empathy, retaliation, sabotaging others. Yeah, thanks everybody. Fear of losing your job if you speak up. People are reluctant to talk for sure. Shutting down comments and conversations, subgroups. It's interesting. Feel free to keep putting things in the chat because I'm going to make a comment afterwards. So, it's interesting to me too, in particularly social service or social work spaces as well, that we're not immune to this as well. I think we do this really well. And I have been in spaces where that is not always the case. And so as we continue to put some examples here in the chat, I really encourage you to take a look at what this team, I'll call us a team for the next hour or so, has come up as examples, because I often do this in class, is you take the question, because often if I say, do you think your team is safe or what are traits? It's like, yeah, of course they are. And people don't want to dig deep. And when you flip it, I would encourage you to take a look at this list that we've just created and take an honest, no one will know, I am not collecting this, but how many of these behaviors exist currently on your teams? And then kind of taking stock of what you potentially address or do, particularly if you're a leader in that space. I'm trying to normalize this is really difficult and it can be challenging to try to address these things, particularly in my experience, if you inherit a team that this is already the culture. So it really does take quite a lot of skill and empathy and patience and grace and all the things to try to do a 180 on teams that are experiencing this. Thank you all for sharing in the chat. And again, I would just encourage you throughout this to scroll back up to the top and review what other people have shared and see if there is anything that is showing up on your teams to note that that's something to address at a later time. So thanks, everybody. Okay, let's talk a little bit more about psychological safety benefits. And so here I have a list of benefits that I wanted to talk through briefly. Creativity really requires vulnerability. Increased psychological safety creates environments that support risk-taking, which supports improved innovation. And so, again, a couple things as we just go through those. So we also experience fewer problems, admitting mistakes. And what I say is modeling fallibility. I didn't coin that. That's also from Dr. Edmondson and some other psychologically safe spaces. But this modeling fallibility that I am not perfect and that I can do something wrong and then I need you to tell me has been incredibly impactful and effective, especially in student spaces where there's a clear power differential. And so really, we experience fewer problems when we as leaders can admit mistakes and model that fallibility as leaders, provide an opportunity to mitigate the impact earlier upstream. It also models and reinforces for everyone on the team that we can learn from each other and those challenges or mistakes and to avoid kind of repeating them again. It improves quality. Issues or concerns are surfaced sooner, allowing for quality improvement sooner. In some cases, it can result in increased safety or security as it promotes team members to speak up. We used to say something in the hospital, see something, say something. And so it really does promote that earlier intervention. With regard to higher employee retention, team members who feel they are on psychologically safe teams are happier, more engaged, and feel their organizations genuinely care about their well-being. We also see improved organizational reputation reflected, both informally and formally through those employee satisfaction surveys that we take often. It results in safer workplaces, lower recruitment and lower sickness safer workplaces, lower recruitment, lower sickness costs, and lower turnover rates. Also create faster innovations, which results in increased productivity and profitability. People are not calling off as often, right? The turnover is not as high. And then finally, we see improved well-being, both for the team and us as leaders. And I'm going to talk a little bit about leader well-being at the very end. It really helps to mitigate burnout, increase overall job satisfaction. All right, this is a little bit of a quiz, and I think it's pretty easy, but we have to sprinkle these polls around. So just for the CE purposes, if you don't mind, which of these is not a benefit of psychological safety? It was just on the screen before. So we'll just give folks a couple seconds to answer this, and then Madison will kindly close it. And again, if you are having any problems with the polls, feel free to put in the chat as well, so you get credit.
I'll also read out the poll options if you cannot see the poll. The question is, which is not a benefit of psychological safety? Your options are improved innovation, decreased quality, higher employee retention, or increased productivity/profitability.
Thanks, Madison. All right, we'll get a couple. Thank you. Thanks, Madison, for sharing that. So yeah, it was decreased quality. It actually increases quality in that space. So thanks everybody for leading into that poll. All right, let's move on to the skills. So we talked a little bit about the strategy of improving psychological safety, but let's talk about some skills. So how do we intentionally increase psychological safety on our team? So there is a few things in here that I want to go over. So first, psychologically safe assessments really should be done not at a one-time retreat. It's not something you do annually. I'm hoping that some of these things can be incorporated by you or by your leader as a habit. So there's really 6 ways that leaders can build psychologically safe skills. One is considering using validated psychologically safe tools. And so there's a couple listed here. Again, Amy Edmondson is kind of the pioneer in this space, so I included her scale, but there's also a Gallup 12-item assessment that you could use in your organization. In addition, observe and note meeting dynamics. Assuming many, but not all on this call, again, are kind of in leadership spaces, as we saw, or social workers. I think that there is, again, assumption in social service spaces and in social work spaces that we do this really well, that we observe dynamics and we address dynamics. And again, that has not always been the case in my experience. I think we see that colleagues behave in certain ways or act in certain ways that don't necessarily align with the organization's values or code of conduct. And even though there's recognition or notice of that, there's not an appetite or will to address it, which then further kind of degrades the psychological safety on the team. So really, as a leader, observing these things, noting who's contributing, what happens when someone pushes back on your team, and then noting patterns of silence or conflicts. I actually really appreciate that several of you noted that in the chat already. Next is leveraging your one-to-ones and team meetings to model that vulnerability, fallibility, and authenticity. And we're going to talk a little bit more about authenticity as well today. Reassess your typical one-to-one check-in questions. So instead of the kind of the generic, how's it going? How's work today? Try to think about some deeper reflective questions potentially. So what could help us be more supportive? What could help us be a more supportive or collaborative team? So just letting someone kind of process that, or saying like, how could we do better in this space? Or are there moments when you hesitate to speak up, and why? Just getting that feedback from someone can also be really helpful in how you maybe design the meeting or design ways in which people can give that feedback. One thing that I also found is maybe considering some trauma-informed practices around certainly notifying colleagues or team members when you do have to seek some maybe difficult feedback or have a difficult conversation. I've seen many, many leaders not do this. And for all of us who've been on the receiving end of an email that says, can we meet at 3 o'clock this afternoon, with no context and no background, it's certainly anxiety provoking. And so just trying to model and allow somebody to process those questions, they will be at their best. They will best be able to answer, hopefully, and respond to your questions in that space. Next, note behaviors that reflect psychological safety. Is your team verbalizing innovations and taking risks? Do they feel comfortable doing that? Again, not being publicly shamed for saying something that might be a little bit outside the box or a little bit something that your team has never tried. When problems arise, are they discussed without assigning blame? We talk a lot here at the School of Social Work, at least I do in a lot of my classes, around how shame is a tool of oppression. And that I have honestly never seen in my experience so far, and people can push back at the end if you have some comments, that public shaming is an effective intervention or tool. I just think it generally shuts down someone. It dehumanizes them in public. It just really devolves over time. And I've never really been a fan. And so just trying to figure out how we can, we talk a lot about calling in versus calling out, but how can we do those things with respect and with grace to try to get ultimately to what we want to do, which is better and safe and productive spaces at work. Next is ask for feedback about your leadership. So you as the leader, ask for feedback, but then take your feedback to heart. I think there's a lot of many leaders undergo kind of 360s or leadership feedback, but we don't really take the time sometimes because we're so busy and inundated. We don't take the time to reflect and really then change our behaviors. I think some leaders are really stuck in their ways and they stay in that space. So how might you vulnerably and kind of honestly request, accept, and incorporate the feedback that you're receiving? And then finally, don't ask if you're not going to do anything with it. So don't assess or don't ask for those 360s. Don't ask for the annual employee engagement results if you have no intention on changing any behaviors or even circling back in transparency with what the data is. It really, again, in my experience, has a negative impact on team morale or organizational morale, productivity, retention, and reputation. Okay, next strategy. The next strategy I'd like to talk about is improving communication. And so there is, of course, in many organizations, more of a hierarchy versus a flat organization. And so we know the downward and upward communication, right? It's either top down, you're getting stuff from senior leadership or the C-suite of what you need to do, or upward, senior leadership is getting some information from those kind of on the ground, if you will. I included horizontal communication because I think it's vital, but it's not necessarily, it's a part of the hierarchy. That in and of itself is obviously not hierarchical, but again, a really important piece that happens. And so some benefits of hierarchical communication: you get clarity and structure. Everyone knows who to report to and where to get information from, right? It's not unclear in that space. You have built-in accountability. It creates a formal record of decision-making and responsibility. You have some control and consistency in that space, so it really helps you maintain uniformity in the dissemination of information. But I think the challenges of this sometimes get in the way of all the other things that I'm going to talk about today. So there's bureaucracy, as we can all appreciate. So information can get delayed or diluted as it passes through all those multiple layers. There's certainly communication gaps. Misinterpretations can arise when messages aren't passed on accurately. And limited feedback, employees might feel hesitant to voice concerns, especially in rigid hierarchies and particularly with rigid individuals. And then bypassing channels. So we see, I've experienced this as well, is in some organizations, particularly larger ones, employees will attempt to communicate directly by bypassing kind of the hierarchy itself, and particularly their direct supervisor. And this practice can really deteriorate the organizational culture, creating a sense of mistrust and undermining the hierarchy itself. So other ideas around communication I was trying to think of is how do we prepare ourselves for kind of future communications with our employees and with our team members? Again, taking into consideration that we're trying to build this overall psychological safety. So I just put some questions. Again, this is not exhaustive, but some questions to help prepare a leader for interactions with their team. They're really meant, the intention is to build perspective, build empathy, and build rapport with folks. And so I don't have to read them all, but just some things around employees' past supervisor experiences. I remember inheriting a team. Again, I had not hired anyone on this team, but I was asked to then kind of step into a management role. And in my one-to-one, some of the many things that came up was their experiences in the past and their expectations of how this one-to-one would go, and how their past supervisors had treated them well or not well, and what worked for them, what their learning style was, what their feeling is around productivity pressures. And it just gave me a sense of the level of anxiety or concern or the level of engagement and enthusiasm that someone had on the team. And I tried to use that. And I think one of the things I've also evolved to do, which I'm not, again, other people can chime in as well at the end, is that I've evolved and I've learned that you really have to discern how to communicate with different folks at different times, because it's not about my expediency of relaying the communication to 10 people. It's about me taking the time to understand that there's 10 different people and what is the best way in which they can hear the information that they need to do the best in their job. All right, next, another leadership skill is just around discerning those communication strategies. So let me talk a little bit about these. So there was a 2025 study in the Journal of Mental Health and Social Inclusion that found that servant leadership training can actually support leaders in developing the skill and insight to engage in minimizing power distance, encourage shared decision making, seek and receive feedback, which fosters increased psychological safety. There's also an opportunity where, again, skills that we could maybe lean into or take on if you're interested is reframing the mistakes when appropriate. And so I'll say, sometimes the mistakes and just naming them and moving on, if you had a psychologically safe team, that could be okay, right? You learn from it. You decide that that's not something we want to repeat, but let's talk it through. How did we get there? What are the steps that led to this potential mistake as a team or as an individual? But I think reframing it, so if we can approach team mistakes without judgment, but with grace, and still hold team members accountable, I think you get folks who remain engaged in that space a little bit more. You also certainly can encourage all voices or perspectives when feasible. I also want to just maybe call out at this point a little bit about finding creative or additional ways for your team to communicate their needs or concerns. I think it's more inclusive, and I've tried to learn, this is a growth edge for me, is trying to learn what are different ways that the team can give you feedback. I think we have centered often because of time and, again, expediency, that I come to a meeting as a leader, I come with an agenda, and then I expect everyone to be able to process that in real time and give me feedback right away. And some folks, as we know, just need extra time for processing, or they prefer to give feedback not verbally. And so how can we find as leaders to slow down a little bit, but also signal that we're inclusive of different opportunities to give that feedback? Next is to appreciate contributions, both privately and publicly. So what I want to say about this is practicing gratitude and recognition with individuals really creates team norms to me, and in my experience, it creates and builds a culture of appreciation. But I'll say I have also found it to be helpful to approach challenges as well. So I'll give an example. There's been times when one person comes into a team meeting and expresses something really difficult. And maybe it detracts from the team situation. If you can picture a team and one person comes in, they're just really angry or upset about something, and you can tell that it completely tanks the rest of the team. Maybe they're even disparaging of other teammates. They're just not, it was not a good interaction. And I have found that some people will find that insight later, and they'll come back to me in the one-to-one and say, hey, you know what? I thought about it. I'm really sorry. Or that was just not my best. I had a lot going on. But what I've been trying to encourage folks to do is also to understand the impact on the team. So it's one thing to acknowledge it to me, and I certainly try to accept that with grace and patience, but also to encourage that person to repair the harm with the team. And so when you privately and publicly do things, both acknowledgement, but also correcting wrongs is one thing that I think is hard, but I think it's necessary. And I think it's been really helpful for teams as well to say, yeah, the ripple effect of that negativity impacted all of us. And the repair only happened with the one person, sometimes the supervisor. So it's really important to kind of circle back in that space. And the final one is coach and mentor others on your team to maintain the culture you're attempting to build. Having others on your team initiate psychologically safe behaviors can actually be an incredibly impactful for all on the team, especially for new team members. All right, so next we're going to use the chat a little bit, as interactive as that can be. So do you have any examples of how generational shifts in the workforce are changing your organization's culture and strategy? And I know this might seem like a pivot, but why I wanted to bring in generational shifts is because I see that looking at some labor force data here and looking at generational differences may help us strategize for future communications in this space. So if you have any thoughts or ideas around how you've seen generational shifts, we'd love to see that in the chat. So someone put technology. So yes, thank you. That it comes up quite a lot. Keeping status quo without reflection is interesting. Oh, how people view burnout maybe has shifted over time. Communication styles for sure. Yeah, I'm going to touch upon virtual and hybrid work environments and kind of the expectations or demands by different folks. Utilization of PTO, ethics and self-care, how ethics and self-care are perceived. Awesome. Yeah, lots of technology stuff. So I appreciate that. Boundaries maybe have shifted over time. It's also really nice to see some familiar names on here. So hi, everyone. For some of you, hi to new friends, but also hi to folks I recognize. So awesome. So keep these in mind. Please feel free to engage in the chat and see what your colleagues are saying. This is important. Again, I'm going to frame this as I wanted to give you some information about generational differences, mostly so that you can prepare for the workforce to come. So that's at least my intentionality here. Yeah, AI is listed here for sure. Okay, so let's move on. This is the next poll that we have. So Madison, if you don't mind opening this up, I can read it as well if you want to put these things in the chat. But which generation makes up the largest percentage of the US workforce? And the options are the silent generation, Gen X, Gen Z, baby boomers, or millennials? Some people might be Googling, what years were Gen Xers born or Gen Z? I'll show you a slide in a minute, but just which one do you think, which generation do you think makes up the largest percentage of the current US workforce? Yes, thanks, Madison. If you are not able to do the poll, chat works as well. Great to put that in. Right, millennials it is. So for the over 50% of you who chose millennials, it is actually millennials. Thanks, everybody. All right, so here's a graph to prove what I was saying. So just a little bit of data here. In the third quarter of 2023, Gen Z workers in the labor force actually surpassed that of baby boomers for the first time. So that's when it happened. That's when the crossover kind of happened for that space. In the second quarter of 2024, Gen Z workers were almost 18%, about a fifth of the labor force. And baby boomers then comprised about 15% of the labor force in that space. Millennials make up the largest share, as we noted in the poll, with about 36%, while the silent generation has almost entirely retired at this point. They make up about 1% of the workforce. Gen X occupied the second largest share at 31%. And the Gen X share has declined modestly at a similar rate to that in which millennials also increase, which makes sense. So as one generation eventually kind of stops working in the workforce, you'll see the future generations going up. And as you can see the trend line there, you'll see Gen Z as being a steady increase. And of course, we are looking at data. So the data that I'm about to present to you from Purdue Global, they took Gen Zers who are in the workforce now, because many Gen Zers are not of working age. And so just noting that in the data as well. So I think they took only folks who are 24 years of age and older at the time of the poll. Okay, let me just share a couple insights around generational differences here. And so some considerations for leaders in this space. So I did promise you to put the dates. And this is an asterisk slash premise for me, is we know that there's some generational shifts. And if you kind of Google some of this, some people will have the years off by a couple years. And so this is the data that they used for this particular website and information, but again, it might change slightly. I think those in transitional years are also really interesting because they're kind of navigating things from both generations. So that's also something to be noted. And the other premise that I have for this is these are generalizations. And as we know, not everything will apply to all generations. So if you see yourself in here and you're like, this is not how I see things, totally get it. This is just the data that I pulled from, again, Purdue Global, just to do some generalizations of how do we conceptualize the potential workforce that's coming in. So for this one, I thought it was interesting just to say, like, what are the major events in this generation's lifetime that may have impacted them in particular? And so oh, I just thought, yes, the traditionalists are the same as the silent generation in that other chart. So it's the same. Thanks for asking that. And so, you think about wars, currently how it's impacting us, but also the different wars over time. But Gen X really had the AIDS epidemic, for those of us who remember that and the impact of that, fall of Berlin Wall. And then you think about for Gen Z, life post 9/11, and they also have never not experienced technology. So from the day they were born, technology has been a part of, and I will say as a side note, the fact that I had to explain to my children that I predate the internet was a big moment in the Kong household. So I am older than the internet, and that was a funny moment for everybody. All right, so a little bit else around communication style. So I kept the years up there so you could see, but just around communication style, how has that changed? And I'll say as a social work director over at the hospital, and we would see increasing new grads or certainly student interns, there was a shift at some point that we all noticed as field instructors and as managers around communication and the reticence to engage in certain communication styles. So I'll give one example, and this was years ago, but calling patients. And so we did not, this was pre-COVID, we were not doing a lot of Zooms. Students struggled quite a lot, and some, again, newer grads struggled with even phone conversations because that's not how they were engaging. They were used to more asynchronous or written communications, particularly either social media or texts or IMs. And so it really was actually a learning curve for folks to understand how to build rapport in that platform. Even though for many of us, I will say for myself, that phone is the most comfortable. And I'm used to engaging in that space around doing assessments and building rapport, even when I can't see them. And so that was just an interesting kind of trend that we were seeing in the workforce, at least when I was there. And then, oops, sorry, what? About the worldview also. So again, these are generalizations per Purdue Global. It does not mean that I am disparaging of any generation by any means, but I do think what's interesting, and I'm going to focus a little bit on Gen Z because that's the emerging generation. But if you think about how folks who maybe were in the workforce as baby boomers or Gen X, about their approach to the work and their worldview and how that influences things. Things like when I was in school, part of my worldview was I can't wait to find a job and stay there forever and retire and be done. That is definitely not the take right now, the current take on current younger workforce members, generally speaking. There is actually specific guidance to you should change jobs every few years because that's how you're going to increase your salary. It's a strategy. You should not be wedded to a particular organization for too long. You go by your values. And so there's a lot of that changes, of course, as you know, retention and turnover and all the ways in which we might want to strategize around how workforces are. So this is just a little bit about folks' worldview. Again, the technology was mentioned several times around the shifts in generation. I would agree with that. And thinking about just for Gen Z again, and I'm going to give you some additional stats in a second, that they really self-identify as digital device addicts, which is interesting, and that they prefer to work with millennial managers versus some of us who are maybe not in that space, as they see them as maybe more innovative and familiar with new technology. And so the final thing that I wanted to share was just some statistics that I'll leave up here. I'm not going to read them all. But again, I wanted to give, this is a data from ranging from 2020 to 2024. But just some interesting statistics. And I think, one thing that I was struck by among many things on here actually is the baby boomers, that 10,000 baby boomers reach retirement daily. So that's one just interesting. How are we supplying the demand that will be there? So that's one thing to consider as you kind of move forward and shift. But the other thing is just around the Gen Z, 67% want to work at companies where they can learn skills and advance their skills. And so here's some additional things. So Gen Zs, and this is not on the slide, but just some additional statistics for y'all to keep in mind for future hiring potentially. 83% of Gen Z say they want a company committed to DEI. And so in this current climate, it's interesting strategy for some organization to decide what to focus on or what values or how they even reframe some of those core values of DEI. That Gen Zers really care about organizational values. A survey on LinkedIn said 87% said they were willing to leave a current job for another company that more closely aligned with their values. 87% is quite a lot to me. According to Bloomberg, 70% of Gen Zers say they will look for another job if their employers require them to be in the office full time. So again, these are the folks who kind of came into the workforce around COVID. And so their perception of in-person work and virtual work has shifted. Over 50% of Gen Zers feel they missed out on an important part of adulthood because of how the pandemic affected office culture. And then 83% of Gen Zers consider themselves job hoppers. And 13% say they intend to stay no more than 4 years with their current employer. But I think Gen Z gets a bad rap sometimes. I think sometimes I've been in spaces where sometimes older generations, and maybe this is just how it is. Us, sometimes in old generations, we make assumptions or have some biases towards those who are coming up next, but actually find a lot of resilience in Gen Zers. And I think Gen Zers also, that statistic I'm going to point you back to, 67%. 67% are willing to stay and be engaged in their space if they can learn skills to advance their careers. And I have found that younger career individuals, both students and again, kind of post-grad folks, early social work career, they really crave mentorship. And I think they crave some of the connection, they crave advice and mentorship and sponsorship, however you define those things. And I see it as an opportunity and motivation in my current role, this is a way to impact and connect with some of those folks as well. Okay. Next, strategy, number 3. Let's talk a little bit about promoting and modeling authenticity. I had a very senior leader that I worked with once, and I made the comment in a team meeting because I felt like there was some inauthenticity showing up in how they were conveying information. And I felt comfortable saying this in a one-to-one. I certainly didn't publicly shame them because that would go against what I said earlier. But in my one-to-one, I said, those statements really didn't land for me, and this is why. And I worry a lot about kind of how we as a leadership team are showing up, and then it didn't come across as authentic. And one of the interesting kind of feedback, at least for me, was the question, well, how do you define authenticity? And so I'm going to put this definition here as we can talk through it a little bit. But I said my piece around this is how I see authenticity, and it wasn't super different from you have some integrity in this space. And again, this is alignment between the leader's actions, values, and beliefs. And the response back to me after having a conversation around authenticity was one of defensiveness, and was one of, well, I think authenticity is subjective, and I don't agree with you. Okay, that's fine. And continue to lead in a space that I didn't particularly find the direction to be really engaging or inspiring in any way. But I do think that for many of us, we know authenticity when we see it. And I think we also, though, need to think of how we're showing up in spaces to do what we can to show up as authentic leaders as well. I think it really fosters trust and openness. And of course, our NASW Code of Ethics around ethical conduct. But again, it ties to psychological safety. So I thought it was important to highlight here. What's the impact of authentic leadership in this space? So there was a 2025 research in the Management Research Review Journal that examined the joint impact of authentic leadership and organizational factors on employee well-being, basically. So how does authentic leadership and organizational factors really impact the employees that are working there? They drew on organizational support theory, and the study examined how that leadership perceived organizational support and their human resource management practices, so HR, really influenced that. And the results showed that perceived organizational support really mediates the relationship between authentic leadership and employee well-being, so kind of burnout and stress. Specifically, supervisors with authentic leadership was associated with reduced employee burnout and job stress. And furthermore, the association between authentic leadership and perceived organizational support was strengthened when staff perceived HR management practices as fair and supportive. That should not be rocket science to anybody here, but I think it's proven through the study of kind of the interplay of all those things. And then finally, additionally, the organizational size actually moderated the relationship between authentic leadership and staff, with the relationship being stronger in smaller organizations, which makes sense because leaders have greater visibility and interpersonal proximity to those employees. Okay. Let me talk a little bit about niceness versus kindness. I'm going to show a quick video. I thought this was really helpful in the framing of, again, we're talking about communication now in this space. And I think this is just a really important piece to share. So I'm going to share, actually, I don't know if I optimized give me 1 second, I apologize, to turn on the sound. Okay. I cannot see anybody now. All right, so I think what I want to do now is just share a very short clip. It's about a minute and a half.
If you ask most people, what is kindness? Everyone thinks first and foremost about like a person that you're interacting with. Very seldom do we think of kindness to ourselves, and very seldom do we think of kindness to someone that's not there or that we don't see.
How are you defining kindness?
Well, the way I break it down is I go, what is not kindness? Niceness is a good example, right? A lot of people are nice.
Yeah.
You know, I find a lot of, like, for instance, Scandinavian, Swedish people, not very nice, but very kind. And it's a very complicated thing to understand, you know, because niceness is the performance of kindness, but it's not necessarily the action. You know, it is a nice thing to say something to somebody. It is a nice thing to smile at somebody, but kindness is doing something. Do you know what I mean?
Giving somebody harsh feedback, hard feedback, is kind but not nice.
Yes, if
not
you've
giving
done it in
somebody
the right
feedback
way.
is nice but not kind.
It is very nice.
Yeah.
You know, like, for instance, this is a small thing, but I'm always thrown when someone has something on their face and no one tells them. It's very nice to not tell them. You have something on your face. Don't tell them. You're being nice. It's better to be kind and be like, hey man, your face. Do you get what I'm saying? And I think it's a very simple example of it, but it's also a very complex idea because one makes everyone feel like everything's going right. The other one is being able to embrace the discomfort of what's not, in a way.
I think you're touching on the thing that I think we're both teasing out of this, which is true kindness is uncomfortable.
It
nice,
can be,
nice is not uncomfortable.
Yes, that's how I break it
that's
down.
the difference.
Yeah.
There's a discomfort in kindness.
Yes.
Being kind to yourself is uncomfortable because it means I have to put myself first. I have to give myself grace, and sometimes it's easier to just beat myself up or not.
Right.
And I think kindness comes with, dare I say it, courage.
Oh, sorry. Give me a second, everybody. Sorry. So sorry about the tech issues for a second. Let me just reshare this. So that obviously was a conversation with Simon Sinek and Trevor Noah. You know, what I liked about that is obviously the differentiation, but, you know, Trevor Noah goes on, if anybody's seen that clip, he goes on to talk a lot about the difference between niceness and kindness. And he actually used the health system as an example, is that, you know, his experience, some nurses, not all, but some nurses are not necessarily nice, but they are very kind. They will go on to do the things that you need to do. They will push you. They will encourage you even when you're grumpy and you're not feeling your best, but that is out of kindness that they're doing it. But again, the delivery may not always be the nicest. So again, I would find just that differentiation a reminder to some of us that having those hard conversations is really the kind thing to do. I think sometimes I've also heard in spaces, clear is kind, but it's just how do you build that skill of how to deliver that. All right, the last piece that I want to share is just around leadership restorative care. And this is our final poll. And so, Madison, if you want to share that, how would you rate your own self-care or restorative care? And again, I'll say it out loud in case people can't see it. So if you can't see the poll, how would you rate your own self-care or restorative care? Excellent, good, work in progress, poor, or non-existent? And I appreciate it's anonymous, so we will not know who's answering. Thanks everybody for those in the chat who are answering. We'll give you a couple more seconds. Great, thanks, Madison. So the majority of you all on this call say work in progress. That's very humble. It's very social work-like. And so 2% are excellent. That's awesome. And so let's talk a little bit about kind of restorative care in the space for, I took it as a leadership, with a leadership kind of lens, but it certainly applies to all of us. So again, our code of ethics really requires this of us now. This was an addition later on. And so just as a reminder that this is what it says in our code of ethics now. And again, I'm not sure how you all would characterize your own self-care journeys, but for mine, it's evolved over time. I think as a new career social worker, I remember being hyper-focused very much on boundaries, both kind of time boundaries and emotional boundaries, to kind of shifting to now, whereas how I understand restorative care is not really about discontinuing or boxing in those behaviors, all of them, but it's also about incorporating and adding in behaviors, activities, or mindsets that ensure my longevity and my ability to be present in all situations, both personally and professionally. So again, that restoration piece, it's not just about stopping things, it's also about what can you add in this space. There are certainly benefits of self-compassion and practices. And so just a few things, they're listed here, ranging everything from well-being overall to however you define well-being to physiological functioning and improvements in that space. So we know that this is important. We teach our students this. We try to support one another in this space. What I also think is really cool is that there's also research being done in this space around how self-compassion may show up differently or the same in other intersectional identities and cultures. And so I referenced a few there just around diverse populations, because I do think it certainly matters. I grew up in a very different household than my partner, who comes from a very more strict East Asian background. And their, I will say, approach to wellness and self-care is very, very different. And so it's been a shift and an opportunity for me to share with them what I do, but also for me to understand what they view as self-care and what I could maybe learn from them as well. So it's been really mutually beneficial. It's led to some really cool conversations. Leadership skill here in this space, what I wanted to share is about modeling self-compassion and resilience. And so when we think about creating a compassion daily practice, let's talk about a few potential skills. So one, take our own advice, do the thing, right? So Lily Zhang is a great author who I really like if you're not unfamiliar with their work in the DEI deconstructed books and workbooks. And there was a quote in there that says, quote, "Learning to practice and extend the same compassion towards ourselves as we would extend towards others is what allows us to sustain our work over the long haul." Next, we want to talk about seeking to increase your awareness of colleague psychological well-being. So when you think about kind of these life events, and I always, talk to the team about, we just experience so many things together because we're together all the time at work, is, let's say, for example, someone experienced a loss, like a personal loss, and whatever that looks like for them. How do you offer support tangibly, or do you? I think some people feel reticent to offer support in some spaces. They want to give them space. But I do think it has been powerful for some to discern kind of when to offer that space, and how do you signal you're even willing to offer support in that space as well. So that can be pretty powerful for colleagues. The other thing is encouraging and demonstrating increased positive contact with colleagues. How can you intentionally build in, I'll say, micro interactions and micro affirmations throughout the day? That really does also impact kind of I would say giving to others can also increase our own self-compassion daily practice, but it also is life-giving to the person receiving it. Next is inviting more authenticity, as we talked about earlier, and work to increase psychological safety in our workspaces. I think social workers, again, are uniquely trained to approach these spaces with inclusive and equitable lenses. And then we discussed earlier how to model and shift the culture towards these more psychologically safe spaces and through authentic behaviors. And then finally, it is take on the perspective of others you work with. This is not limited to colleagues to me, but also to leadership and our students. How might we practice kind of counter biasing in the workspace? I think I've been in lots of conversations where people make huge assumptions based on communications that come out or based on actions of certain folks. And I think what they don't often realize is the full picture, the confounding contextual elements that led that person to make the decision they did. It maybe doesn't excuse how some of this information is delivered, but I do think having an exercise of some perspective taking can build some empathy and can build some, honestly, strategy around how to address the concern as well. I put a link, but I'll name it here. I know you all don't have the slides with you right now, but how to be more compassionate. There's a mindful guide to compassion. If you Google that, there's actually a guide there that you can walk through for yourself as well as a potential tool or resource for you. All right, and the final kind of slides, because I want to make sure we do have some time for questions and answers. So thanks, Madison, for putting that in the chat. I want to talk about resilience as well. So resilience is defined, at least by this author, is the ability to regain balance following exposure to an adverse event or events. And this really, for me, came to a head in COVID, particularly being in a health system, around witnessing resiliency in action and seeing how the resilient leaders that I wanted to emulate in that space. And so let me just go through a few things from this study from Southwick. It was actually just published in, this is one that was actually published in 2016. Sorry, I was mixing up my references. So this one was published in 2016 around leadership and resilience. And so let's just go through a few of these, focusing on, as leaders, mission and unity of purpose. Resilient leaders really demonstrate continual support of an organization's mission. It's through our words and our actions that team members are able to visualize a positive mission charter for the organization and hopefully effectively communicate the plan to others and encourage really a strong attachment to that course of action. Resilient leaders also have strong characters and moral compasses. They believe in a core set of moral and ethical principles that help guide them and give them strength during times of uncertainty and stress. Leaders have resilient leaders learn to have realistic optimism and risk management skills. Realistically optimistic leaders understand that an underestimation of risk and an overestimation of ability can lead to failure. So let me say that again. Realistically optimistic leaders understand that an underestimation of risk and an overestimation of ability can really lead to failure. So these leaders really do not prematurely sound the alarm, nor do they engage in confirmation biases or immediately discount information that does not fit with the expected business plan. So again, kind of learning to sit with some of that information and not maybe, I would argue, be reactionary in the time has been really helpful. Lean into change management, facing fear, and cognitive flexibility. Modern leaders, particularly those in fields that are rapidly evolving, I would argue again in the social service space and social work spaces, really must know how to foster innovative change. Resilient leaders encourage adaptive change as well. Some really good work in leadership around adaptive leadership and adaptive change and appreciative inquiry that I would recommend to folks. Resilient leaders also encourage social support and build team cohesion. Resilient leaders and organizations understand the importance of really creating a strong social network. When it comes to organizations, one of the most effective social networks to solve problems and achieve coordinated action is an interdependent team. Next is recruiting effective team members. This is one of my most favorite, actually, is hiring. And so two of the most important character traits in prospective employees, according to the study, are industriousness and enthusiasm. They also list other important characters in team recruits, such as loyalty, a sense of unity, cooperation, inquisitiveness, creativity, and flexibility. And then finally, work to develop team strengths. Successful leaders know that in order to guide and to motivate an effective team, they really need to assess and understand the strengths and weaknesses of each team member. So I want to end on this note, actually. So I recently was able to give some remarks at one of my mentors' retirement events. And I wanted to share, because it was recent, I wanted to share some of the lessons that I learned from this person. This is not evidence-based. I did not do a study, but this is more anecdotal, and this is more just part of my lived experience. And I was really grateful to have been mentored by this person. And so let me just share a few of these things. Reminding your team of your values kind of loyalty to those values and to the greater purpose was one of their strengths. And what I mean by this is all of us who reported to her over those years knew that even though we weren't in the room, if you will, or at the table, that she represented us well, that she knew our jobs really well, and she knew us as people really well, and she knew the work really well. And so we really didn't have any anxiety around her representing that. And that loyalty and sense of appreciation and respect really kept a lot of folks on that team for a really long time because of her leadership style. Number two, show your team that you're invested in them as people. As we know, right? Our team members are lots of things outside of work. They are partners, they are parents, they are grandparents, they are pet owners, etc. And she was really good at building rapport with folks and kind of, I'll say, what am I trying to say? Like having rapport deposits, if you will. Like she would remember that your kid had a recital and she would ask you about it later, or she would remember that so-and-so is having a surgery and would check in on you if you knew that was happening. And inevitably, what was really interesting about that is when she did have to have direct conversations and really challenging conversations or challenging what somebody had to say or do, even on that team, because she had that respect and rapport, those generally went really well. The next one is don't ask anyone to do anything you're not willing to do. And I live by this as well. I think leaders should be willing to do basically anything that they're going to be asking their team members to do, including stepping up when other team members are not able to do their function, to do some cross coverage or to show folks that you are, again, willing to do anything for the team. The next one, monitoring the team's time off. And so this was actually really interesting to me. So when she first trained, she said, look at their PTO, like look at their PTO bank. And if you see someone who is not taking their time off or they're about to max their bank, check in with them. Don't berate them, don't criticize them, but more say like, you're not taking enough time. How can we help you? Again, lean into restorative care. How can we help you take some time off? You know, this is not meant to be publicly shaming or privately anyways. It's just meant to encourage you to take some time off. And the last one, this person had excellent sense of humor. And so she always said, kind of take the work seriously, but not ourselves. And I think a little levity and humor with respect and good timing. So I'll add those two things because I think some people maybe are a little off-putting in their timing sometimes. But levity and humor, I think with those two things combined can be very effective in spaces around building rapport. So just wanted to share some of those things. Like I said, it was recent for me, so I wanted to share some of those lessons learned. And because at the end of that retirement celebration, I said, your legacy will continue on through all of us who reported to you. And so now I feel like I am sharing this all with you all as well. And that is my presentation. And so thank you all so much for hanging in with me. We do have some time for questions or comments. I'm going to stop sharing at this point. And I think, Madison, you said you might be able to unmute folks if they would like, or certainly if there's questions that have been submitted in the chat. Really want to appreciate your time. But Madison, are there any questions or does anybody want to unmute? Could raise your hand. I don't know how it works. Yeah.
Yeah, it looks like there's some questions in the chat. But like Erin said, if you do want to unmute, raise your hand. We will give you the option to unmute yourself at that point, and then you'll be able to ask your question. But the first one in here, Erin, is about curiosity of what compassion looks like with a mostly remote team.
Yeah, that's interesting. I see some folks on here actually who I know who we did remote team meetings with during COVID, which was really interesting. So what does compassion look like on remote teams? I think, again, we could crowdsource this because I think now that I see some names, there's some mentors and great folks in here who have lots of experience, but I'll answer in this way. I think that there's a way to connect through Zoom that we have learned through COVID that you can humanize folks and actually make a real connection over Zoom. I think the deal breakers to me are having cameras on. And I know some people, I think there is inclusivity in I cannot have my camera on this time just for this reason. But talking to squares, as we know, and honestly, a little bit in this space of a webinar format, it's really hard for me to read a room. And so I think there's some deal breaker level setting expectations on Zooms, but I also think compassion can be a couple ways. How you run a meeting, it should be similar to me. Some of the intentionality should be in Zoom. I also think though, over virtual spaces, it feels formal So the compassion part I think about honestly is some of those like informal moments of showing compassion, those micro affirmations or micro, however you want to call it, right? During the workday when if we're in person, I could stop by your office and be like, I'm going to get a donut. Want one? Right? Having a hard day. Seems like today is really hard. And you can't do that because it's awkward to me, at least, to say, hey, doing okay? I send a chat message, want to hop on a Zoom? Like it feels more formal. And so I would just say, think about ways that you can either normalize hopping on a Zoom for remote teams or to build in some type of structure of a virtual huddle that maybe you don't have an agenda, maybe you normalize some of the topics or the ways or the connections that you have for folks so that it's less awkward. If you then can normalize the behaviors of chatting someone in Slack and saying, hey, today was terrible. Does anybody have an opportunity to hop on a Zoom or can we have Zoom coffee? And I think that maybe is something that comes to mind. I haven't really thought about it entirely, but I appreciate the question. And again, if other people have other things in the chat, you certainly can share it.
Yeah, here's another question for you. Can you
Yeah.
speak to founder CEO syndrome and how to create a psychologically safe work environment with existing barriers that cannot change?
Yeah, that's tough. Founder CEO syndrome. That's actually interesting framing. I have found, I guess, a couple of things how to respond. I have found that there are assumptions made around the inflexibility around senior leaders, and there have been few instances where I see shifts of change. And so one, I would say, don't make an assumption that you can't be impactful in that space, particularly as a middle management leader. I think there's strategies, there's also networking, there's also, good old social work around kind of ground roots, getting some information from down to up, right? Upward mobility. So one is don't make assumptions about your senior leader, but two, I will say that there are also, for me, I was in a situation in which I felt like senior leadership wasn't very inflexible, rigid, and not going in the way I found a lot of moral distress in the way that some of senior leaders where I was working. But what I chose to do is compartmentalize that, which I know social workers know very well, and to say what is within my sphere of influence. And I do think that for me as a leader to not, for example, completely trash senior leadership. I did have my moments. People on this team, some of these calls could have attest to. You're human, and you do have some moments. But I think where I landed was what is within your sphere of influence at what level you are as a leader and as a coworker, and how can you make that environment the most psychologically safe and or helpful, productive, et cetera. Because ultimately, I think as social workers, I'll just say a little bit the bias is we have a moral obligation to our clients and communities we serve. And so even though you may not have the ultimate power to do all the things and it's not exactly 100% how you think it's running, what can you do in that space? And I think ultimately people make decisions to leave organizations because it's untenable and that there's privilege in that too. But I do think at some point you also have to know where your line is. It's a good question.
One other question in here is, can you speak to what makes an exceptional supervisee to you?
Oh, that's a good question. I think this varies for leaders and actually in the chat, or if anybody wants to unmute too. I think it's a little personal preference. For me, a supervisee is ideal if they are teachable, humble, engaged, and flexible. That's where I've landed. Is I think when I would hire in the very beginning, we look at resumes and we look for skill and we look for competency and we look for sometimes years of service and we weight those as different or maybe even better than. And in my experience, there are really, really seasoned clinicians and leaders who are terrible teammates, who are detract from the culture that you're trying to grow. And there are up and coming folks that maybe have less experience, but who you could see could grow and flourish and they're teachable and they're willing to be mentored. And that is the ideal person to me because they're going to teach you as a leader, but you're going to walk with them in their evolution. And I also think leaders have to think more about you should worry more about the human. You should worry about the person on your team more than you worry about the work. And I think that's sometimes at odds with people because it's about productivity. I heard someone once come to me and they were really frustrated. I was actually a team member then and not a leader. And their parent had just been diagnosed and they went to their supervisor and shared this. And the response, the immediate response at least, was, well, how much time are you going to take off? Do you think you're going to take off more than X? It wasn't, gosh, I'm so sorry. What do you need? How can we support you? And they left really disheartened and they left really frustrated, and it turned to anger and it turned to disengagement and apathy in their job. And so I think it is hard. I think you get pressures from above to always be productive as a leader and show your worth. And at the same time, never lose sight of you're dealing with humans, and that should be the most important to me. And again, I've evolved over time. I think my leadership I'm still learning a lot, and I'm still trying to evolve in this space as well. But I think that's how I would answer that question. It's a good one. Thanks.
I've got a couple more for you, Erin.
Okay.
This one says, I think use of PTO is very important for teams to be able to have work-life balance, but I've been on several teams where supervisors thought it was inappropriate to ask or encourage time off. Is that sometimes an institutional policy to not monitor or encourage individually?
Again, I don't have experience working in 20 different companies, but the manager who's approving the PTO, and you have your own PTO bank, but I think it's at the discretion of, like, I've never seen a policy that says don't talk to someone about their PTO. So no, I think it's a culture thing. I can't imagine that folks would discourage trying to care for your employee in that way. And so it's an odd, actually, conundrum to have. Like, I actually see it as a non-issue. So if someone in senior leadership would push back on me on that, I actually would question kind of what's their intent or motivation or concern even around that. Because if you have, again, even some things here, if you have folks who are investing in themselves and improving their wellness, they're going to be more engaged and more productive at work. And honestly, just legally and financially, like, the organization owes it to them. So no, I don't know that there's a policy or there's any legality around that. That feels like a culture thing.
A couple more. So one asked if you have any additional resources of example questions to bring to supervision conversations around reflection, safety assessments, ongoing mentorship, or growth.
I mean, that last piece is actually great. Like what opportunities are there for me? And I think having that, even, I would argue, as a standing agenda item on your supervision can be great. I mean, we often do like annual goals, and then people forget about them because nobody addresses them for each quarter like they're supposed to. And then you get to the annual review process and you're like, what were your goals again? Or what were my goals again? And so I would just encourage you to take that seriously. If someone's going to take the time to create goals, work with them throughout the year. But I think the other thing I think the question was me going to my boss, what would be good? I think putting it on your supervision. I think finding opportunities yourself, so being proactive and bringing that to your supervisor. Is there any way that I could attend this training or certification, or is there financial support for it? Or is a way for me to use, is there any kind of PTO equivalent of continuing education time? And what I'll also say is, when possible, saying yes to opportunities. Because I often find that actually supervisees feel like they don't know what they don't know. And I think sometimes also there's a little bit of a propensity to be like, I'm not doing anything unless I get extra, or I'm not doing anything unless you pay me, or I'm not doing, and I get that to some extent. I don't want people to be abused or taken advantage of, but at the same time, if your vibe is, I'm not doing anything than what I minimally need to do, that is going to be your reputation. And I always talk a lot about new career folks is every day is a job interview, and people often don't forget the things that you do. And if you're constantly giving the vibe off of like, don't bother me / don't give me opportunities, they're not gonna. And when you talk about not being in the room, there are gonna be senior managers or middle managers all the way up that you want them to think of you when you're not in the room. You want to be the person that's like, hey, what about this person? I think they'd be good. Why don't we ask them? Why don't we give them this opportunity? And so it's kind of playing the long game, I think, is my advice in that space. But just coming to supervision prepared and asking and being inquisitive and asking for those mentorship opportunities, even if it's not from your supervisor, but maybe it's from somebody else. My final thing I'll just say is I remember attending a women in leadership conference, and they talked a lot about finding your own board of directors. And I think that's also been really helpful for me, is what are some people outside of maybe my organization? And I have them, actually. I have two people who I can go to, who know you well enough to speak into your life professionally, sometimes personally, to say, what are you doing? You're being ridiculous about whatever decision you're making. Or when they uplift you and validate you and say, hey, you want to go for this new promotion, do it. And you're like, oh, I don't know if I'm ready. And those folks, those personal board of directors can be the ones to kind of encourage you to be in that space and give you honest feedback. So that's also been something that's really helpful for folks maybe, or at least for me when I was not in leadership, to find some folks.
This next question, I think, kind of goes hand in hand with your every day is a job interview statement.
Okay.
They asked if you've ever heard of stay interviews, which are the opposite of an exit interview, exploring what's keeping a staff person in their role and what else would make their work experience better.
Great. I have nothing bad to say about that. I think why wait until someone's so mad and so frustrated and so disillusioned, and honestly, you don't get good feedback anyways, and the feedback in my experience doesn't go anywhere. It doesn't result in change. I think people do exit interviews because they think this is their last opportunity to contribute to the greater good. And in my experience, it gets buried. It gets overlooked. It's a little performative. And so I love stay interviews. More organizations should consider it. And I'm not an expert in this, but I have heard a little bit more of the shift to, yeah, why don't you engage the folks who want to be engaged and actively work on retention? I love it. Like, I think that's really cool.
One final question for you. They said, I work in a large health system where there is disconnect between team members' feeling of support from their direct leader, which is generally positive, versus from the organization where there are more concerns. Do you have thoughts about how a direct leader can support the team as they express concern for organizational factors?
Yeah, this is hard. My take was, and how I learned, again, I know personal experience, but it was the COVID thing. We didn't all agree in the hospital about the ways in which certain senior leadership, like the way in which the health systems were being pushed, and changes that were made. And yet I felt very powerless as a middle manager space. But what I'll say is lead with authenticity and truth, and don't BS people. So I think people can smell, especially social workers, when you're trying to social work them. Don't do that. And there's a balance to me of being real and acknowledging, again, that fallibility or fault, and saying, I don't know the answers, but I commit to you to telling you what I know and at least my perspective. And I also commit to taking your feedback up. I think there's something in that, in building trust and rapport, to say, I will take your feedback. I will take it up. I think that teams, other people can, I guess, again, kind of push back on this, but I think that teams respect that they know that that person's doing what they can within their role. And that would be my advice to that middle manager person, or to the teams, to be honest, is if you find a good supervisor, I think, I don't have the statistics, but most people leave their jobs because their supervisors are crappy, right? They don't leave because of the work. They leave because they feel unsupported. They leave because they're mean. They leave because they BS them all the time. So if you find a supervisor that's really good, I think there's something there. It still may not be tenable for you in the long run, and that's a personal decision, personal and professional. But I think it's about the integrity, I guess, is what I'm getting at. I should kind of wrap this up. I think it's about the integrity. Say what you're going to do. I often talk to new students around clinical stuff. And when I would say, if you promise to follow up with a patient in the hospital, say, I'm going to come back tomorrow at 2:00, I better see a note in the chart that you went back and saw them. And I think the same is true around follow through on teams. Is if I say I'm going to take your feedback, I better send the feedback, and I better circle back in a closed loop communication and say, this is the feedback that I heard from your feedback. And I think it just builds that honesty and trust. And I think that goes a long way. And again, ultimately, it still may not be the right place for you. But I think how you show up and how you talk to folks and follow through is probably the most important.
Erin, thank you so much. Before we wrap up, I just want to tell you that you are getting all the love in the chat. So if you want to take a look at that, I think it's really great. But somebody did say that this was one of the most authentic presentations they've seen in years. And I would co-sign on that.
Thank you, everybody. It's very kind. Thank you so much for spending an hour and a half with us. I'll turn it over to Madison and Jan if you have any closing statements. But really, thank you all so much for your participation and for your time today. Appreciate it.
Oh, I just want to thank you, Erin. This was so informative. I took so many notes. I really appreciate it. So thank you for being with us today.
Yeah, I'll echo the thanks. Thank you, Erin. This was amazing. Thank you, Jan, for being here and introducing Erin. And thank you to everyone for attending the first session of Building Healthy, Strong Communities. We hope to see you at another session this afternoon. The second session, titled Financial Essentials for Social Workers, Building Financial Security to Strengthen Impact, will begin at 1 p.m. Eastern today. In the next couple of weeks, those who have met the attendance requirements will receive an email from our continuing education office. Any questions regarding CE should be directed to the CE office. Their email is on the screen, but it's ssw.conted@umich.edu. Thank you again for being here this morning and have a wonderful day.